Do you see any disadvantage in staying in ketosis long term? It sounds like with your lifestyle, you're going to naturally have periods where you're having celebratory meals and things where you're pushing yourself out. But for somebody that's extreme type A and pushing the limits right now and heard about the 100-day sardine challenge and decides to go long term without ever leaving ketosis, you hear a lot about that being a problem. How do you feel about long term ketosis not having a break?
I just think we're dealing with humans. Come to the front line and show me one of those people. And I'll tell you what happens is that, yes, there is, I call them the ass over apricot patient, where they just tumble down the hill and they do everything they're supposed to do and they have all of this energy to do ketosis and then they crash. Okay, because that's human behavior. So when I have that type A person and I can see them just stacking up all the pressure to be perfect, I tell them that's not what I'm trying to get you to do. I want you in the zone of life. But let's take Jane, the lady who did the 100 days. I had no reservations about what she was doing as far as the sustainability in ketosis because of her diseases that were haunting her. The specific one that she talks about is plantar fasciitis. Okay, so there's a tendon in your heel and it connects all the bones of your foot. And when you have it full of calcium, crusted from chronic insulin, and then years of excess weight, and then you can put some steroid injections in there. You can go in there and have them try to needle it and cut it open and do a few things. But let me tell you how those people turn out. It is not a great solution for a terrible problem. What she needed was to apply autophagy to sweep out the trash in her Achilles tendon. In her plantar fascia. I'm sorry, I said Achilles earlier too. That plantar fascia doesn't have a blood supply hardly. It's a tendon. So it is this diffuse place that a chemistry set will take advantage of. But a day in ketosis is not going to help that heal. Even a month into ketosis, and she said my pain was from a 10. A very strong woman, military history. She was at a 10 many days. Now is down to a 5. It took the 90 days before, that's probably in the 60, 70 days where she was pain-free, and she is still pain-free. But what was happening inside her cells is she was so delinquent in taking out the trash in many areas of her body that a persistent state of ketosis was the only shot she had to sweep it out. And it was in that journey that she addressed something that was really important for the sustainability of her. The Joe Rogans of the world would say, what was her arsenic level and what was her mercury and what was her, there's another one they always want us to test. Anyway, we checked all of them. They were fine. They were not pathologic at the end or the beginning or the middle. We checked them 3 times. But what people miss is she left that season with the best tool, which is she knew herself. She realized volume was a much bigger issue to her than she was giving it credit for. And to control it, she has some rules she's going to apply. And does she get to go back to the season that she was before? No, because that life was what was burdensome in a metabolic way to her system, aging her into a wheelchair that she couldn't do her job. She was going to have to retire. So when people say, well, do I ever get to go back to drinking booze when they come in for alcohol addiction? I'm like, you got the wrong focus, buddy. Stop thinking about the thing that has destroyed your life right now. Let's think about how do we give you a better life? And they can't often hear that at the beginning. So I do not say that early in their story. But that's the gift that is hidden into any sustainable change of health. That what Jane was missing was the threads in life that she takes pleasure from, that she was using food as that place to say, this is when all else fails, I know I can just feel better when I eat. And to awaken some of the things that she was touching on, but had not really embraced in service in her community, helping her sister and her, being a part of the full picture of what she has to offer in life. That's the gift that came out of that restrictive diet. And I think when I see practitioners, chirping about a life of ketosis has these, awful consequences. First of all, show me the evidence. I will tell you their bone density gets higher, their heart disease gets less. they can't be playing in ketosis. They actually need to be measuring ketosis. This is the difference between what I think some of the studies out there are looking at and some of when you see a clinical application where you follow a strict protocol. And then you look at the fullness that she got because she figured out that this was how her life should have been conducted as far as an eating behavior long ago. That woman doesn't want to go back. She doesn't want the life that's outside those rules that she now applies. And just like the alcoholic, when you give them a little bit of alcohol and they're in those first years of sobriety, it awakens that neural pathway up. It is big. It is a number 9 wire in their brain, Jesse. And one drink opens up this closet that they had closed the door, unlocked it, and thrown away the key, and now it's back. And so to say, oh, don't do it forever, it just says you're teasing them. Do not show them the life they get. Quit focusing on that this is somehow destructive to their brain. It's not. We have really good evidence to the contrary, and that it's hard on their bones. It's not. We have bone density DEXA scans showing to the contrary. And I can list the other places. I don't have any worries about that.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
If I had to put one demon out there for the chronic diseases that have filled my internal medicine clinic for 20 years, insulin wins. You can say, Doc, I want to check a fasting insulin. And we have lots of people do that. But the fasting insulin...